Hi, I'm Dr. Brad Shook. I'm a board-certified chiropractic physician here in Hickory, North Carolina, and today I'd like to talk to you about what causes leg pain with bowel movements. And so this is really an important topic. If you are, if you're moving your bowels or if you cough and you feel pain shoot down your leg, then you absolutely need to have someone take a look at that immediately. Here's the thing, when you cough or when you're bearing down and to move your bowels, that we call that pressure when you're holding your breath and you're pushing, that increases your interabdomen, or the pressure inside of your abdomen. And what that does is that pressure puts a lot of force on the spine, and it causes a compressive force because the muscles are all tightening up. So the muscles attach to the bones of your spine, and when they tense up, they actually pull together and they cause compressive forces to be placed on the spine, so it pushes the spine together. Now what typically we'll see there is that if there's a disc problem, so the spacer between the bones of the spine, I'll show you on our model. So this is a model of the vertebra of the spine. Here's one vertebrae, second vertebrae, and then here is the disc that spaces them. Okay, so when you're bearing down to move your bowels, this gets compressed, and if this disc is torn, the material inside of it, there's a jelly-like material that can leak out and compress the nerve while you're bearing down. So that pressure on the nerve, let's say this is a nerve in the low back, they go down the leg. So that compression of the nerve can cause sciatica, nerve pain down the leg, and it's a sign that there could be a very serious disc issue. Now other things can cause this too. Other things that could be compressing on the spine, anything that can compress on the nerves could cause that pain down the leg. So it's really important, and this also tends to happen when people cough. Sometimes when they sneeze, they'll have a shooting pain because there's a really quick amount of pressure applied to the spine, really forcefully, really quickly, that tends to cause material in a disc that's damaged to come out, and it can cause compression of the nerve that can cause pain down the leg. And we especially see it with bowel movements. That's really common. And one of the ways that you can actually test yourself is you can just hold your breath and bear down like you're trying to move your bowels. Does that hurt? Does that cause pain down the leg? If so, it's not a good sign, and that needs to be checked out immediately, because that's a sign that there's a very serious problem that's causing compression of the nerve and taking up space. And you can't have compressed nerves for a long time. You definitely got to get that looked at, because if the nerve's compressed, it can cause permanent damage. So something to consider, something to look into. If you would like my opinion on your case, if you would like me to take a look at you, I'd be happy to do so. Just give us a call at 828-324-0800, and my staff will help you schedule an appointment. If you'd like to learn a little bit more about what we do or our practice, just go to hickoryspine.com and you can learn more. But I appreciate you. I hope this has helped you to better understand, if you have pain down the leg especially, or lower back pain with moving your bowels, what you need to consider doing. Okay, I appreciate you. Have a wonderful, wonderful day. Thanks.